Dear learners, today we will discuss the unit Transgender and Health from Module 5 Gender and Health. I am Rajmi Mahanta, Assistant Professor, Sociology Department, KK Hendik, State Open University. Before beginning with today's topic, we will have to look at few important definitions. Since this unit deals with a lot of different terms, it is important for us to know the meaning behind them. So, let us discuss them. Number 1, trans man. A person who was registered as female at birth but who lives and identifies as a man. Trans woman. A person who was registered as male at birth but who lives and identifies as a woman. Binary. The gender binary, also known as gender binarism, is a classification of gender into two distinct opposite forms of masculine and feminine, whether by social system, cultural belief, or both simultaneously. Non-binary. Non-binary is an umbrella term for gender identity that is not solely male or female. Non-binary identities fall under the transgender umbrella since non-binary people typically identify with a gender that is different from their assigned sex, though some non-binary people do not consider themselves as transgender. Next, cross-dresser. Cross-dressing is the art of wearing clothes traditionally or stereotypically associated with a different gender. Gender incongruence. Gender incongruence refers to an individual's discontent with their assigned gender and the identification with a gender other than that of their birth sex. Gender identity. Gender identity is the personal sense of one's own gender. Gender identity can correlate with a person's assigned sex or can differ from it. Next, gender expression. It is the way in which a person expresses their gender identity, typically through their appearance, dress, and behavior. Next, gender dysphoria. Gender dysphoria is the distress a person experiences due to a mismatch between their gender identity, their personal sense of their own gender, and their sex which was assigned at birth. With that said, let's proceed with the introduction of today's topic. In our immediate surroundings, there are people who do not fall into the mainstream idea of sex and gender. In India, we often see hijras or the officially recognized third gender community. The term has been translated to English as eunuch or hermaphrodite, where the irregularity of male genitalia is central to the definition. In general, hijras have been born male with only a few intersex variations. Some of them undergo an initiation rite into the community which is known as nirvana. However, as we discuss about transgender, we cannot ignore the controversies behind it. A lot of times, the actual meaning to it is not known clearly. Transgender is actually a term which is used to describe people who identify or express themselves as someone not corresponding to the sex assigned at birth. Transgender men are individuals who are assigned female at birth but identify as woman and vice versa. It is an umbrella term which includes trans men and women along with binary and non-binary people. Often, they are referred to as the third gender, and at times, cross-dressers are also brought into its fold. Transgender falls in the T category in the umbrella term of LGBTQIA+ community that stands for lesbian, gay, bisexual, transgender, queer or questioning, intersex, asexual, and many more. Cisgender people are completely opposite of them. They comprise the social majority whose gender identities and expressions are congruent with birth. Since trans people belong to the gender minority and fall under gender incongruence, their non-conformity with the social expectation rewards them with stigma, negative attitudes, and challenges related to discrimination that range from workplace, accessing public accommodations, and healthcare. Throughout their life, at some point, most of them experience a term called gender dysphoria or gender dysphoria. We will broadly discuss about it as we proceed to the health issues related to them further in the chapter. Now we will discuss briefly about transgender with focus to India. Gender variance in India has ancient prehistoric roots. The community encompasses of Hijras, Eunuchs, Kothis, Aravanis, Jogappas, Shiv Shaktis, etc. Historically, Hijras played a prominent role, but with the beginning of colonial rule, the situation changed significantly. Criminal Tribes Act 1871 deemed the whole community innately criminal and addicted to the systematic commission of non-bailable offences. The mistrust of the community didn't go past the judgmental society even after independence. In a judgment in 2014, the Supreme Court perceived the transgender community, generally known as Hijras, as unnatural and generally as objects of ridicule and even fear on account of superstition. Hijras in India have an active social organization of both traditional and ritualistic. They are seen as unique. They earn a living by prostitution or by performing a traditional naming ceremony at the homes of newborn infants. They sing and dance in such occasions. They are nowadays often seen in public transports at certain stops where they mount on the buses to collect money from the passengers. Now we will proceed to discuss a bit about differences between intersex and transgender. Intersex people are born with sex characteristics such as genitals, chromosome patterns, etc. that do not fit the typical definition of male or female bodies. They can identify themselves as lesbian, gay, bisexual, or transgender. It is a reproductive anatomy in which a female body with female genitalia might have a typically male reproductive anatomy inside. In such cases, parents and doctors may decide to designate a sex to the baby at birth. However, being transgender means there is a mismatch between the sex assigned at birth and gender that one identifies with. For example, in case of transgender women, they would have been assigned as male when they were born for displaying the physiological characteristics that are typically male, but may identify themselves as women within the social constructs of the world. With that said, we will now discuss some issues that are faced by the transgender community. Following are some of the major issues. Lack of legal protection. Trans people often face a legal system that does not protect them from discrimination based on their gender identity. In workplaces, they are often violated verbally or through actions such as prohibition to access public bathrooms. Often, they are subjected to sexual violence. Apart from that, they are subjugated to custodial violence, dereliction of duty by state, and overall apathy by state on their issues related to health, education, residential, and medical facilities. Poverty. After being ostracized from the society, often they find themselves in isolation. They are treated as outcasts. They receive little to no education without the support of social institutions like family, peer groups, and school. This in turn leads them to being unemployed in the future, which again leads to poverty. Lack of housing services sends them to live in the streets. Identity crisis. Even after the passage of Transgender Persons Protection of Rights Act 2019, which allows the community of self-perceived gender identity, they are often forced to identify with a gender which they are not associated in all walks of life. they may not only experience an inner sense of not belonging but also violation of basic human rights. Psychological distress. Transgender people, as mentioned above, suffer from discrimination, stigmatization, and harassment. A lot of them learn to cope with that. Sometimes they have the support of their families and friends and transgender networks and organizations, unlike most of the times, which help them to get through it. However, a significant number of transgender people, especially the younger generation, which face harassment in the form of homophobic tests that includes bullying in school, physical or verbal attacks at public places, all of these has culminated into negative impact on the mental health of the victims, leading them to be psychologically distressed, perform self-harm, and have suicidal thoughts. Transphobia. Transphobia on a larger scale arises from moral, religious, and political beliefs of the dominant majority. They discriminate the gender minority in every possible aspect of life, be it comical media portrayal or negative attitude in workplace and schools. The hatred towards them and the unnecessary interference in their personal lives has led the transgender people feel lonely and unwelcomed. Discrimination at workplace. Even if they are educated, the outlook of the society forbids the transgender people to have a high-paying job that respects their qualification, which is why they find themselves either at a much lower profession or might as well find themselves completely unemployed. Sadly, some might resort to sex work and prostitution as a means of income. The ones who are deprived from education also end up doing the same. Other kind of discrimination includes exclusion at workplace, unavailability of restrooms, etc. Lack of healthcare coverage. Exposure to basic healthcare in their case is minimal as they are subject to apathy by medical fraternity. The professionals lack healthcare expertise. According to Human Rights Campaign Foundation, 22% of trans people and 32% of trans people of color have no health insurance coverage. More than 29% of trans adults are not given a doctor's assistance because of their gender identity. Moreover, in most cases, accessibility to healthcare depends on who can afford treatment and surgeries. Such trans people have a supportive family and a very solid economic background since the procedures are quite expensive. Now, we are going to discuss about the topic transgender and health. Compared to regular population, trans people go through more chronic health conditions and are at the high risk of getting HIV/AIDS and fall into substance abuse, mental and sexual violence, physical violence, as well as higher chance of diabetes. Structural, institutional, and individual barriers to access of healthcare, cultural incompetency from the healthcare providers to encounter unique challenges contribute to large gap between transgender and cisgender population. The first issue that we are going to discuss is gender minority stress. Marginalization of transgender community leads them to lose the chance of living a fulfilling and appreciable social life, like the cisgender majority. All opportunities of having a positive public attitude, education and health services and housing, income and leisure activities are taken away from them. This leads them to develop low self-confidence and self-esteem at the loss of their support structures. Marginalization takes form of racism, sexism, poverty and many more, along with homophobia and or transphobia. They affect the mental health of the community profoundly. Unemployment and homelessness. Social exclusion and low literacy limits the employment and livelihood opportunities for the transgender community. It limits their accessibility and knowledge of proper health facilities. Moreover, lack of housing services leads them to live on the streets. This is as a result of running away from homes and abusive situations. Sometimes they find themselves at shelter homes which are again abusive towards them. Sexual harassment, drug abuse, prostitution leads them to have a downward spiraling mental health disorders and infectious diseases. Violence. The Transpop survey found out that 48% of transgender adults in United States have been beaten, physically attacked or sexually assaulted at least once since the age of 18. Violence takes many forms. It can lead from intimate partner violence, romantic partner violence, violence in sex work to other relationships. Violence has significant health concerns both mentally and physically. It has been estimated that prevalence of post-traumatic stress disorder among the transgender community lies far on the higher scale of 18 to 16% compared to 6.8% among the general adult population. Discrimination by healthcare professionals. Hospitals, clinics, and doctors' offices should be safe environments where people can get medical care, but for many transgender people, the reality is different. The healthcare providers often outright refuse verbally or physically harm such patients. This is sadly very common. Lack of cultural competence on their unique and significantly magnified issues is another problem because in some cases the patient has to teach the doctor about themselves to receive proper care. Due to above mentioned reasons, the transgender community has been relying on the black market and informal networks to obtain gender reaffirming care. This gives them a feeling of safety rather than having to come in terms with healthcare providers. Cost of healthcare services and unwillingness. The cost also affects the accessibility to healthcare facilities for their defined problems. In some cases, transgender people buy hormones from non-medical provider. This may be because of their discriminatory treatment by the healthcare professionals or maybe because their therapy isn't covered by insurance. Such unauthorized and potentially wrong dosage of hormones carries terrific health risks, which can cause cancers, liver damage, fluid loss, and electrolyte imbalance, increase hemoglobin, and can trigger heart issues and pressure. Since we have discussed about the social factors affecting the health of transgender community, now we are going to briefly look at the importance of knowing about their health. First, to create a safe environment for the community. The transgender community forms an integral part of our society. Therefore, it is essential for us to know about the various issues surrounding them. Health falls under such an important issue. If we are not aware about the serious implications of ignoring such vital thing and continue to discriminate someone on the basis of how they perceive themselves, we would be pushing them further away from the opportunities. Substance abuse, use of hormone therapy from unauthorized sellers, unprotected sex work, and post-traumatic stress disorder have become the reality of the community after being ostracized from the general society. Low sense of security, lack of self-confidence and self-esteem has pushed them to extreme measures. Access to basic health care would not be a topic of debate and discussion if we can try and normalize the existence and choices of trans people. If we stop stigmatizing them physically, verbally, and mentally, we can create a harmonious society where everyone can have access to basic health care and life opportunities. To build a culturally competent medical staff and medical school curriculum. Medical education in transgender health can empower physicians to identify, rectify, change the system barriers, and improve the knowledge about the unique care for the community. Such specific areas include hormone therapy, gender-affirming surgical procedures, gender dysphoria, and mental health issues that include depression and anxiety. Healthcare professionals must be trained about the health outcomes and side effects of gender-affirming interventions. In most cases, health in medical curricula in both undergraduate and postgraduate medical education is looked into from the perspective of cisgender, and there is always a lack of information about the whole LGBTQIA community apart from sexually transmitted diseases. Transgender literature is the need of hour. To build a strong and supportive legal system, it is the duty of the criminal legal system to protect the citizens irrespective of their sexual orientation. Therefore, instead of attributing negative encounters with the transgender community by physically, verbally, and mentally abusing them, they should protect them from the preparators. Making of robust laws to protect the community from discrimination based on gender identity must be backed by tools of enforcement. In the following section, we will discuss about general and specific health issues that affect the community. First, physical health. Sexually transmitted diseases. Transgender community is at a higher risk of developing such diseases and infections because of unprotected sex work or prostitution and because of sexual harassment and abuse. These infections include human papillomavirus, HPV, HIV/AIDS, hepatitis A and B, syphilis, chlamydia, gonorrhea, etc. Hormone therapy or gender-affirming therapy. Transgender individuals experience a strain between their self-identified gender and biological sex. Many transgender individuals seek hormone therapy while transitioning. We will now discuss about two such hormone therapies now. Testosterone therapy. It is used to suppress female secondary sex characteristics and masculinize transgender men. Estrogen therapy. It is used to suppress male secondary sex characteristics and feminize transgender women. Formulations are given in the form of oral, intramuscular, and implants. The effects can be seen after approximately 3 months of testosterone hormone therapy. Cessation of menses, increased facial and body hair, skin changes and acne, changes in fat distribution, increased muscle mass, increased libido, deepening of voice, male pattern hair loss are some of the results of the therapy in transgender males. After estrogen initiation, the changes that occur include breast growth, increased body fat, slowed growth of body and facial hair, decreased testicular size and function. Other therapies include voice therapies and puberty blockers. Gender affirmation or confirmation or sex reassignment surgery. These kinds of surgeries include procedures that help people transition to self-identified gender. People choose surgeries to get out of the distress of their gender identity, not conforming to the assigned sex at birth. Common transgender surgeries include facial reconstructive surgery to make facial features more masculine or feminine, chest or top surgery to remove breast tissue for more masculine appearance or vice versa, genital or bottom surgery to transform and reconstruct genitalia. Common complications of this surgery include bleeding, infection, and side effects of anesthesia. However, it must be taken into account that in most cases, patients experience improvement in quality of life and mental health after a successful transition. Reproductive options for transgender. Nowadays, a range of special reproductive options are available to help transgender men and women to become parents. Transgender women may freeze sperm which can later be utilized by a female partner or gestational carrier. Transgender men can opt to freeze eggs or embryos or even ovarian tissues. Those who haven't gone through removal of ovaries and uterus can even consider carrying a pregnancy themselves. However, the transgender individuals who undergo gender-affirming medical or surgical therapies are at the risk of infertility. Suppression of puberty can cause the menstruation of germ cells, thus affecting the fertility potential. Testosterone therapy can suppress ovulation and alter ovarian histology, while estrogen therapy can lead to spermatogenesis and testicular atrophy. Now we will discuss about behavioral and mental health issues in the transgender community. Gender dysphoria. Gender dysphoria or dysphoria is a term that describes a sense of unease that a person might have because of a mismatch between their biological sex and their gender identity. People may socially transition to their true gender with or without surgery. As a part of social transitioning, someone might adopt a new name, choose different pronouns, present gender identity by wearing different clothing, or changing hairstyle. They may pursue gender-affirming care such as hormone replacement therapy and gender-affirming surgeries too. Not all transgender people desire it. There might be medical and financial constraints to the access of such amenities, but those who go through medical transition, they are termed as transsexuals. Gender dysphoria is not a mental illness but can lead to mental health conditions like depression and anxiety because of inability to match with the identity they desire and want to express freely. People with gender dysphoria might change their appearance, behavior, and interest as mentioned before. Adding to that, there are some other signs of the problems which include low self-esteem, socially withdrawn, depression or anxiety, taking unnecessary risks, and neglecting themselves. Gender dysphoria may or may not surface within the childhood period. As common as it is for a child to show interest in toys or clothes of other gender, the lasting desire in some children might raise concern. Treatment for gender dysphoria can range from confirmation, affirmation, and simple acceptance of their identity to hormone therapies and surgeries for transition in some people. After the required treatment, many transgender people have reported about the feeling of satisfaction and happiness, improvement in mental health, and quality of life as a whole. They experience a sense of gender euphoria, that is, the right feeling of belonging to the right gender after the alteration of their bodies. Mental health issues among the transgender community. Sexism, discrimination, violence, and barriers to health care can all contribute to increased chance of mental health concerns. Researchers say that transgender individuals are almost 4 times likely as cisgender people to experience a mental health condition. The US Transgender Survey reveals that 39% of the respondents have suffered from serious psychological distress and 40% of them had attempted suicide in their lifetime. Depression. Transgender youth are twice likely to experience depressive symptoms, seriously consider suicide, and attempt it as compared to cisgender, lesbian, gay, bisexual, queer, and questioning youth. The 2019 Trevor Project National Survey highlights that more than half of the transgender and non-binary youth have seriously considered it due to barriers in care, victimization, and sexism by cisgender people. Anxiety and transgender health. A study reveals that transgender people experience more significant anxiety symptoms and have a nearly 3-fold risk of probable anxiety disorder. Stress and transgender identity. Transgender people are likely to experience minority stress. The stressors could be environment, discrimination, interpersonal stressors such as expecting discrimination, and personal stressors such as internalized sexism. Substance misuse. It includes the use of illegal drugs, use of prescription or over-the-counter drugs, and inappropriate use of legal substances such as alcohol as coping methods from daily stresses of life. Low self-esteem. Transgender youth are at the increased risk of developing low self-esteem because of the dysphoria and incongruence with their gender identity. Eating disorders. Researchers show that transgender children are at the greater risk of developing an eating disorder such as bulimia and anorexia even more than the cisgender peers. The next topic we will focus upon is the impact of COVID-19 on the health of trans people. The pandemic has resulted in extreme disparities of transgender and gender diverse people across several crucial determinants of health. Financial difficulties. For transgender and gender diverse individuals with intersecting marginalized identities like color, structural, or systematic inequality and discrimination became very prominent in COVID-19 pandemic. Higher proportion of individuals had unstable housing and employment, and greater financial difficulties were reported. Barriers to health services. Access to even most basic healthcare became difficult for them. Finding a new healthcare clinician or evaluation for gender-affirming hormone therapy became more challenging as healthcare systems had limited enrollment and prioritized already established patients in their system. Mental health disparity. Such issues escalated during COVID-19 pandemic as a precaution for the virus reduced access to social support, and it meant losing an important source of resilience against gender minority stress. Now we will discuss about few initiatives that are taken by the government for the betterment of the transgender community. Amongst the various legal initiatives and active working groups for uplifting the health of the community, three of the most important ones are discussed here. Right to Health and Gender Affirmative Procedure in Transgender Persons Act 2019, India. The Transgender Persons Act 2019 mandates that government ensures medical facilities to provide care to transgender persons, including gender affirmative procedures, and review medical curricula to address the health needs of transgender persons. Section 15 of the Act seeks to provide setting up of separate human immunodeficiency virus serosurveillance for trans people in accordance to National AIDS Control Organization. The Act obligates the government to run medical care facilities, including for provision of gender-affirmative surgery and hormonal therapy, counseling, and bringing out health manual under standards of care for health of transsexual, transgender, and gender non-conforming people. It also ensures access to healthcare institutions and centers, provides coverage of medical expenses by comprehensive insurance scheme for surgeries and therapies. Separate wards in hospitals are to be established along with separate washrooms. The Act stipulates that whoever harms or injures, endangers life, safety, and health and well-being, whether mental or physical, of a transgender person shall be punished with imprisonment for not less than 6 months. Ayushman Bharat PMJ for transgender. The government of India has initiated a composite healthcare service under Ayushman Bharat PMJ. The government issues a fund of Rs 5 lakh per transgender beneficiary per annum. The package prepares comprehensive transgender categories including AB-PMJ packages and specific packages for sex reassignment surgery and treatment. The transgender people will be eligible to get any kind of treatment under the scheme. The scheme is applicable for all transgender persons who are not eligible to receive benefits from any other center and state-sponsored schemes. The last one is Humsafar Trust. Humsafar Trust was founded in April 1994 by journalist Ashok Rao Kavi, media professional Suhail Abbasi, and filmmaker Sridhar Rangyan at the time when prejudice and conventional social values prevented gay men and transgenders from getting effective health services. Their initial focus was on activism for providing HIV/AIDS health services to gay men, but soon it was expanded to provide guidance, checkup, hospital referrals, confidential HIV testing, counseling, etc. for the entire LGBT community. Humsafar Trust has nurtured a support group called Sanjeevani, a group of people living with HIV. The first ever integrated community-based HIV treatment center and clinic was built in Mumbai to provide free counseling and antiretroviral therapy. It has been set up with the help of Mumbai District State AIDS Control Society and FHI 360. The aim of HIV/AIDS Art Clinic is to relieve the government hospitals from the constant flow of patients. Before we conclude, let's sum up what we have discussed so far. We began with the meaning of transgender in context of India, and differences between intersex and transgender. Then we discussed about the social causes and importance of transgender health issues. After that, we have discussed about their physical, behavioral and mental health issues which affects them a lot. We discussed about the effects of COVID-19 on their health, and we ended the unit by discussing about 3 important initiatives which are taken to look into the matter. With that, we have come to the end of today's unit. Thank you.